Good afternoon, everyone. I have some brief comments I would like to share with you. In addition to that, we have a few city councilors that will be making comments, as well as our partners from the Jefferson County Health Department, as well as the UAB Emergency Management Team. As of today, which is very different from 12 days ago. 12 days ago, we had 0 cases in the state of Alabama. 11 days ago, we had our first case. As of today, speaking to you, we now have 196 cases of the COVID-19 in the state of Alabama. 86 of those are here in Jefferson County. At one of our hospitals, UAB, 45 cases. People have been hospitalized. 81 people are under observation, and at least 18 people are on ventilators. That is very different from 11, 12 days ago, and I think it's very important at this time in our city and community that we take this very seriously. The last few weeks have been unprecedented obstacles that we face in this health crisis. But with the help and guidance of the Jefferson County Health Department, we've been able to navigate these challenging times. The city must take every reasonable effort to slow the spread of this virus. This morning, I presented to the Birmingham City Council a shelter-in-place ordinance for the city of Birmingham. This afternoon, they will take this up for a vote. I want to thank the council for working with me to keep the people who live and work in the city of Birmingham safe. And shelter-in-place simply means to stay at home. Don't go out unless getting food, gas, or other essentials. Deliveries will still be made, services will be delivered, and a distribution system to our grocery stores, pharmacies, and other essential businesses will be uninterrupted. The ordinance has been placed at birminghamal.gov/coronavirus. Again, the ordinance has been placed at birminghamal.gov/coronavirus. Shelter-in-place ordinance will be effective today through midnight, April 3rd. Based on the circumstances, this ordinance can be extended. To be sure there is no confusion, I want to share with you the ordinance in detail. The first note, this ordinance does not conflict with Jefferson County Health Department ordinance. Shelter-in-place does not apply to the following. It does not apply to public safety or emergency service activities like law enforcement, fire and rescue, and emergency management. It does not apply to first responders, public health workers, emergency dispatchers, law enforcement personnel, and related contractors. This shelter-in-place does not apply to employees and contract workers for utility, cable, telecommunication companies in order to maintain or restore services. And it does not apply to people providing fire, police, sanitation, security, emergency and hospital services, food delivery services, and other deliveries of merchandise and mail. In addition, the order does not apply to people seeking essential services or items. It does not apply to people supplying or restocking businesses in order to provide essential services or products. It does not apply to people employed by the federal, state, county, or city government or their agencies working within the course and scope of their public service employment. And it does not apply to people experiencing homelessness within the city. People vulnerable to the most serious effects of the COVID-19 disease must remain at home unless seeking medical treatment. All businesses within the city of Birmingham shall comply with the order of the Jefferson County Health Officer as it currently reads or as it is amended in relation to the closing of all non-essential businesses. People may lawfully leave their residence while this ordinance is in effect to perform essential activities. These essential activities include the following: visiting a health or veterinary care professional, obtaining medical supplies or medication, buying groceries for themselves or to deliver to others, providing care for minors, the elderly, dependents, or people with disabilities, returning to your home from outside the city, traveling to one's place of residence outside of the city, traveling to or from a place of business which provides essential services, or engaging in legally mandated government purposes. Under this order, any outdoor activities can take place, such as walking, hiking, running, or cycling. Only solitary activities outdoors are included. Any outdoor activity that requires group or contact with others is prohibited. But social distancing requirements must be followed for those who are outside. Indoor and outdoor playgrounds for children shall be closed for all purposes. No basketball, no football, soccer, or any sport that requires contact at any parks in the city of Birmingham. People who need care for a friend, family member, or pet in another household are able to do so. Again, the ordinance and all details can be found at birminghamal.gov/coronavirus. We remain in close contact with Jefferson County Health Officer Dr. Mark Wilson and other leaders. We're also working very closely to provide a comprehensive response to reduce the spread of the COVID-19. We want people to remember traveling under this ordinance must maintain reasonable social distances and practices as available. That includes at least 6 feet of distance. Please continue to wash your hands with soap and water and use hand sanitizer. Please remember to cough and sneeze regularly in your shirt or elbow, and remember to clean high-touch surfaces. Now, I understand that this is a very uncertain and uncomfortable time in our city, our county, and our region, especially considering our history. It was just 100 years ago, the influenza pandemic of 1918 and 19, that our city and our county was hit with the health crisis. I want to remind people who can hear the sound of my voice that as a city and a region, we made a full recovery and a rebound from that. I am more than confident if we take these measures now, we can also recover from the COVID-19 health crisis that is affecting our community now. I know the wounds of the dark times still ache for many in this community, but today is different. Today we're simply asking you to briefly remain apart so that we may come back together even stronger than ever. I want to reassure you that we will be on the right side of history by making this decision. And it is up to Birmingham to once again set the example for leadership as well as compassion in this region and state. At this point in time, I want to call up Councilor Hunter Williams, who is the committee chairman of the Public Safety Committee for the City Council of the City of Birmingham.
Thank you. Thank you, Mayor. My name is Hunter Williams, and I proudly represent District 2 on the Birmingham City Council and chair our Public Safety Committee. As COVID-19 spreads throughout our state and the city of Birmingham, I want to thank the mayor and his willingness to enforce this shelter-in-place ordinance that the City Council will be voting on this afternoon at 4 p.m. This ordinance will allow the City of Birmingham to enforce through our police department recommendations that the Jefferson County Health Department has already made to the public. This in no way limits what is already allowed under essential business or what is considered essential business, such as curbside pickup for restaurants, grocery store access, medical pharmacy visits, and other things that the Jefferson County Department of Health have deemed essential. I think that right now that this is one of the hardest decisions that leadership is tasked to make, whether or not that we ask our citizens to stay inside, which we know will have slowing effects on the economy. A lot of thought was put into this, and I think that we as a city need to unite to flatten the curve for a short period of time so that we can come out stronger on the other side. We ask everyone that visits Birmingham, that works, lives, and plays in the city, to please follow the shelter-in-place ordinance that will be voted on this afternoon. I think that all of the social distancing rules, along with the shelter-in-place ordinance, will provide a situation where we are going to come out on top, and we are going to be a stronger city as a result. Thank you very much.
Ladies and gentlemen, at this time, I would like to bring forth Councilor John Hilliard, who not only represents the City Council District 9, but has been a champion for quite some time, pushing in my ear, as well as his colleagues, and to the community, the need to get to where we are today. And it's appropriate that he speak to you to address his concerns. Councilor Hilliard.
Thank you, Mayor, and to the constituents of Birmingham. Today is an awesome day, a day that we should embrace. We should spread the word that the mayor in this great city and our President Council, William Parker, have brought forth. And along with my colleagues on the Birmingham City Council, I am so proud to be standing here with all of them today because we are making a difference. This ordinance will save lives. It will make a difference. So we need all of you to employ your friends, your church members. We need your help all the way around. We need all the neighborhood presidents. We need all of the leaders of this great city to band together to follow the ordinance that have come out today to help us with this shelter in place. I implore you to make yourself a committee of one and police yourselves and make it work. This is a matter of lives and saving lives. Thank you, Mayor. Thank you, Council President. Thank you to Birmingham City Council. I am so proud to be standing with you, John Hilliard, Birmingham City Council, District 9. Thank you, Mayor.
Thank you, Councilor Hilliard. At this time, we will have Dr. Wes Williford, who is with the Jefferson County Health Department, to provide a health update from the Department of Health.
Thank you for the opportunity to speak. So I do want to say very briefly that this is a very, very challenging time for all of us throughout the United States, particularly here in the Southeast. And I really want to thank Mayor Woodfin and the City Council for being able to push through this effort and be able to take it up for consideration. These are the core actions that are required to be able to stop the spread of this disease. Unfortunately, we do not currently have a vaccine. We do not currently have medications that are known definitively to treat this virus. And because of that, we are limited in what we can do. But what we can do, and what we call upon the community to do, is to take this harsh step, extreme step, to be able to isolate from one another, to keep your distance, to be able to stop the spread of this virus. Let me tell you the cost of this virus. The cost of this virus are many, many, many lives that will be lost if it is not contained, if we do not do a good job. But those lives, that includes the lives of our mothers, our fathers, our grandmothers, our grandfathers, but also our healthcare workers, our doctors, our nurses, our lab technicians. Everyone who works in a hospital or in a doctor's office could be put at risk of this virus if we do not act now. This is why this is so very important, and it is going to take some time. Unfortunately, the changes that we make today, it may be a week or 2 weeks before we see the benefits of those actions. So I do ask that everyone remain patient through all of this. But I do want to say I recognize how big this sacrifice is, and I recognize how hard it is to make these actions. But this is our moment. This is our moment to beat this virus. This is our moment to be able to come out on the other side, like Mayor Woodfin said, and we have to do it, and we will overcome this. Thank you.
Thank you, Dr. Williford. Before we get into any questions, I do have one more important person to provide an update, and that is Dr. Sarah Nafziger, who is the co-chair of the UAB Emergency Management Committee, who will provide you a pretty important update.
Thank you, Mayor Woodfin. On behalf of the entire UAB leadership team, we thank you for giving us this opportunity to address you today. For those of us on the front lines of the pandemic, we urgently need the public's cooperation today. If you haven't already started social distancing, please do so now. If you can stay at home, stay at home. UAB Hospital at this point has isolated 45 total COVID-19 patients, and we have another 81 patients that we're currently waiting for test results on. I'd like to share this with you graphically to show you what this looks like. We've experienced an exponential increase in the number of patients over the last few days. Evidence is overwhelming that Jefferson County and beyond is and has been experiencing rapid community spread of COVID-19. I want to be clear what I'm saying about this, what this drastic and rapid increase means to our community. This is a dangerous situation that our community needs to take seriously, and everyone has an important responsibility right now to save lives. I'd like to reiterate to you, please, please stay at home. Practice aggressive social distancing. And what that means is stay at least 6 feet away from others. Sanitize the things you touch every day and wash your hands for at least 20 seconds often. Most importantly, stay at home and avoid others. There's been a lot of discussion in the media about personal protective equipment and the shortages that we've been experiencing in the healthcare community due to several different factors that are beyond our local control. I'd like to say that this is an unprecedented time, and we're making decisions based on what's best for everyone, based on what we have in supplies today. It is known to us as leaders of UAB medicine that we will have to make some very difficult decisions in the coming days and weeks. We ask for your cooperation, and we ask for your prayers for our healthcare workers as we face this unprecedented event. We'd like for the community to know that we are here for you and will continue to be here for you. We ask that you do your part to help us overcome this challenge and save lives. Thank you.
Thank you. So we will open up our phone lines right now. I know that a couple of reporters are having difficulty getting on the line just momentarily. So I got a couple that we'll do with text. I would like to remind everybody who's on the call, reporters wise, please mute, and I'll call out your organization and you can ask your questions. Let's start off. I believe is WBRC. Actually, WBRC was texting me, so they're not on. So I'll follow up with them. WIAT, or is WIAT have a question?
Yes, WIAT has a question.
Go ahead with your question.
Are police prepared to enforce a shelter in place with such short notice?
The answer to that question is yes. Although this ordinance will be in effect immediately, all the cities, all the law enforcement in all the cities in Jefferson County have been in constant contact at least every other day with calls and updates from the Jefferson County Health Department. What Dr. Wilson and his entire leadership team at the Department of Health for Jefferson County have put in place weeks ago was already from a compliance standpoint. And so our police, along with what already exists for the county, for any other municipality, is not only ready to enforce what we've done, but other cities are ready to enforce what the county has put in place, separate from the city of Birmingham.
Thank you, Mayor. I know that I'm going to try to go through who's on the line right now so we can make sure everybody has an opportunity. WBHM is on the line. WBHM, do you have a question?
Yeah, can you tell me a little bit more? I'm looking at the order right now, and it talks about a specific safety curfew. Is that timelines or just all over? Can you just talk a little bit more about the safety curfew? Is there a specific time at night as well? People have to come indoors if they do decide to be outside.
The ordinance you have before you is for 24 hours, so it's all day, all night.
Okay, I believe, do we have WVTM on the line? Is WVTM on the line?
Yes, we're here.
Go ahead with your question.
My question is there a penalty in place for those who don't follow this ordinance? And if so, what agencies will enforce it?
Under the general code, as well as under the law provided from the state to the city of Birmingham, this ordinance does have enforcement powers where our police can use what's necessary. I want everybody to be reminded that an existing curfew exists for certain ages, 18 and under, in our city right now for certain times of day and certain times of night. And so this style of what we're doing is not new. What I will say is that I don't believe we'll have to get to that point. I am more than confident that majority, if not all of the people in our city limits, as Councilor Hilliard said, will be a committee of one and have enough self-discipline to make sure we're all doing our individual part to be in compliance with this, to make sure we don't spread the COVID-19 to our own daughter, our own son, our wife or husband, our own mother, grandmother, father or grandfather. We all have to do our part, and I think everyone will be in compliance with this. Just stay right there and ask.
WBMA, is WBMA on the line? Do you have a question?
Yes, this is Cynthia. Two questions, actually. First, for the medical folks on hand, can you share any demographics on the hospitalizations and if the folks are from the local area or maybe brought in from other counties that didn't have hospitals that could adequately care for them? And then for the mayor, you know, with the first of the month coming up, a lot of folks have been approaching us worried about paying rent at their apartments and their homes. Can you give any assurances that these folks are not going to be evicted? They're so concerned about their living conditions right now as well.
I think to the first part of your question, as it related to detailed information around people who are hospitalized, we want to make sure we comply with the HIPAA law. So that's information that we couldn't publicly provide from the city, or those healthcare providers would not provide you that information. In addition to that, the second question around our hourly employees. And so let me see if I can break this down for a second. We know that this healthcare crisis has also created an economic crisis. This economic crisis first hits our small business owners who depend on hourly workers to provide the frontline services they need at their place of employment. If that employer goes out of business, then those hourly workers are laid off. And those hourly workers who were dependent on those walk-ins and cash flow are now in a position where the next week to 30 days, they're concerned about paying their utility bills. They're concerned about paying their rent. They're concerned about just finding a way to live. We as a city are also concerned. I want you to know within our power, there are certain things we can or can't do. But what we can do is continue to have conversations with people. The conversations last week started with those utility providers, such as Alabama Power, such as AT&T, such as Spire, and the Birmingham Waterworks, who've all shared that they are more than willing to continue to work with their individual customers, whether the residential and or commercial, and that if a customer has a problem, they are to engage, pick up the phone, and call the customer service line to one of those utilities. You transfer this conversation to those as related to paying their rent, again, on the residential or commercial side, that conversation gets harder. Part of that reason why that's harder because that's not necessarily in the city of Birmingham's control. But know this, to any hourly employee that is feeling this pinch, to any small business owner that is feeling the pinch of their commercial rent, we are actively as a city with our leadership capacity and relationships doing everything we can to engage those at the state level and federal level and those in the private sector who are due to be paid. What can we do? What creative ways can we come up with? We don't have those answers yet, but we'll stay in constant contact with them to find some form of relief.
Is there anybody on the line who we have not gotten a call from? Is there anybody?
Yes, Anna from AOL.com.
Yes, go ahead, Anna.
Okay, I have two questions. So first, Mayor, I know on Saturday the Alabama Attorney General did send a memo to all law enforcement informing them of their legal power to enforce health orders from the health department. So how is this ordinance any different than the enforcement power the law enforcement already have according to state law?
Right. So this ordinance that's before you all that the council will vote on speaks to the city of Birmingham and a stay at home, a shelter, stay and shelter ordinance. This allows for us to be able to regulate our right-of-ways as well. In addition to that, through a proclamation that I've already issued under the emergency powers that I have, to be in a position to also regulate any form of assembly that takes place in the city limits of Birmingham. And so it's not necessarily against what the Attorney General has said. It's definitely actually works well with the county health department. What we're doing is really important, and I can give you a couple examples. The first thing is this. We spent the last 11 days speaking to recommendations. It is now time for every single person in this city, regardless of age, to take this seriously. And so we are moving away from recommendations and with this ordinance going to full enforcement. The second thing is we know some people believe that this is a vacation or this is some time to just relax and be outside having fun. And part of that is true, but we can't have a situation where we close a park, but young people or adults still decide to be able to go into a park and just come into contact with each other, play basketball or any other sport with each other, then be in a position to they're promoting community spread by doing that, not just with themselves and their immediate family members, but the people they're coming in contact with. And so what this is isolated to our city limits with our enforcement powers to make sure we're doing everything we can to protect our residents in this city from community spread.
Last question here. I believe, Anna, you had a follow-up.
So what are those enforcement powers? I've not heard a good explanation of what that enforcement actually means.
Right. That enforcement is no different than the current curfew law that exists for any 18-year-old. Again, as I've stated, I don't believe we will actually have to enforce or arrest anyone. I believe most people will disperse if we catch that activity. But if need be, the law is pretty clear on the police powers of the city of Birmingham.
Okay, that's going to have to wrap it up at this time. Thank you, Mayor. Just a reminder to reporters out there, this is at birminghamal.gov/coronavirus. There may be one change to the language just based on the timeline because it'll be voted on later on today. You can get information there and follow back up. Thank you very much.